Well, eThekwini is now closing down its vaccination sites, including its beachfront pop-up areas. Let's find out why this is. I'm joined this morning by the city's Musa Gumede. Musa, good morning to you and Merry Christmas. Why are we closing all of this down? I thought they were doing quite well.
Morning, Gareth, and Merry Christmas to you and everyone watching. We have had a long period with COVID, and we then started a vaccination program, starting with the 60 and above, and then going down to the current environment where everyone can come for vaccination. At the beginning, we had a lot of people coming forward to vaccinate. Over time, it has tapered down across the country. Some of our sites are seeing very few people. Secondly, we've also had a surge in the infections in the region. We are now the epicenter of the fourth wave, and therefore some of our healthcare workers are also infected. They are not severely infected, but have mild symptoms. So we've taken this opportunity because of the two reasons to say that during holidays, let's give our health workers a time off, so that they deal with their health issues, but two, they get new energy so that when they come back, they are refreshed and we get ready for the opening of schools and universities.
So is this a closing down of these sites, Musa, or is it just a suspension of services for now? Just clarify that for me, because I can't imagine closing down pop-up sites along the beachfront is a very good idea, considering how many people need vaccination. So are you closing down or are you suspending services?
Yes, we've got two types of sites. We've got permanent sites like clinics. Those are continuing to work throughout this period. 24-hour clinics will continue doing their work. Hospitals will continue doing their work. We then have community sites. Community sites include halls, include pop-up sites like you are indicating. Those are the sites where they're in the community centers, they are in the shopping malls, some are in the beaches. Those are the sites that are taking time off on the holiday days, 25, 26, 27, and also on the 1st and the 2nd. They will then come back after those days. We've seen very few people taking advantage of pop-up sites. We hope that we will use this opportunity to think of new strategies to actually get them to use these sites. Especially along the beach, very few people have taken advantage of the availability of these sites there.
So when you start looking at the different strategy, try and get people to get vaccinated in eThekwini, what is one of the main ideas that's come through? Because obviously the closing down of this showing it's not working. So what are some of the initial ideas you have to change strategies to get people to get the jab?
I think more communication. It requires a lot of stakeholders, but the issues we're dealing with are mostly the young people and social media, and what is on social media, the myths that are there, the different experiences that people share, which are not necessarily factual. So we've got to have a strategy of communication to deal with some of those issues, especially around vaccines and what they do to you and what the intention is, and all the myths surrounding vaccines. So that strategy to actually communicate more, communicate better, communicate in all platforms, and be everywhere, and use role models that young people can identify with, so that the message is acceptable to them as well. So that's one of the strategies. The second one, obviously, is there have been discussions whether to make this a compulsory or not, and universities have taken a stance on this matter. And to support universities, we've got to make our sites available to universities so that their stance of saying when you come back to universities, only vaccinated can come on campus can be supported by our sites. So we need to have a discussion with them so that everyone has access to the sites, those that are going back to universities. But those
It looks like we're about to lose you, Musa Gumede. I'm afraid the line is beginning to drop on us at the moment. My apologies. I'm going to leave it there for now. I think we did get the point of why it's closing down for the moment. eThekwini closing down vaccination sites, including its beachfront pop-up, but explaining as to why that is. Very low vaccination numbers. They're going to go and rethink the strategies to try and get youngsters, it seems, into these vaccination sites in eThekwini, but also a number of healthcare workers, frontline healthcare workers getting infected as well. So for the safety of them, to give them a few days off to rest and recover, eThekwini is closing down some of their vaccination sites, including the all-important beachfront pop-up sites. There are still other places to go, of course, as we heard from Musa Gumede from eThekwini joining us this morning.